Good afternoon, everyone. We are the Group 3, and for today's, for this afternoon, we're going to discuss the vitamin and the vitamin drug containing. So, what is vitamins? So, vitamins are organic substances not synthesized within the body, and this is also essential in small amounts for the maintenance of normal metabolic functions. And this term, vitamin, this was actually derived in 1911 when an amine thought to prevent beriberi, and this was isolated from rice bran. This is also essential or vital amine was called a vitamin. So as you can see in the left portion of this PowerPoint, this is the rice bran. So vitamin was as isolated from rice bran. So vitamins, again, these are organic substances. They are synthesized sa atong body and essential siya for the small amounts for the maintenance of normal metabolic functions. They actually do not furnish energy and are not utilized as building units for cellular structure. The lack of specific vitamins can actually lead to distinctive deficiency states such as like beriberi, mga buntis, then rickets, scurvy, especially if you are lack of vitamin C. So, naadjud kay scurvy nga deficiency nga mahitabo sa lawas and xerophthalmia or to conditions without definitive symptoms. So, next. Vitamins are actually distributed widely and are normally ingested as constituents of various food substances, so such as fresh fruits, leafy vegetables, eggs, and also liver. Standardized, partially purified concentrates and isolated vitamins can be obtained for commercial purposes from a variety of animal, either microbial and plant sources. However, chemical synthesis is more feasible for many of the vitamins. So, vitamins obtained from natural sources and those prepared synthetically are indistinguishable biochemically, nutritionally, and therapeutically. So vitamins, they may be used as special dietary supplements or as drugs. Vitamin supplements are technically foods for special dietary needs and are unnecessary in most cases in which there is a balanced diet. Vitamins are considered drugs if they are taken to treat a condition of vitamin deficiency or to prevent the imminent development of a disease. So kasagaran kasagaran mga patients kay need nila mag-vitamin para ma-treat lamang ang mga deficiency sa lawas, especially for example katong scurvy, so need niya nga mag-inom og vitamin C para ma-treat to siya nga deficiency because maybe the patient kay naa siya deficiency sa vitamin C. So deficiency conditions are the classic therapeutic uses for vitamins, but recognition of their utility in a variety of hereditary conditions, or whether it is inborn errors of metabolism, which is increasing. So situations in which vitamin supplementation is frequently indicated to prevent development of deficiency states can be grouped into four general categories. So, let's go on sa fat-soluble vitamins. So, vitamins A, D, E, at saka K. So, these are the fat-soluble vitamins. So, para mas dali lang siya ma-remember, we have here the mnemonics, which is ADEC, vitamins A, D, E, at saka K. So these fat-soluble vitamins are similar to oil and do not dissolve in water. Fat-soluble vitamins are most abundant in high-fat foods and are much better absorbed into your bloodstream when you eat them with fat. So vitamins A, D, E, at saka K are fat soluble. Their absorption from the intestinal tract is actually associated sa lipids, and a deficiency state may be caused by conditions that impair fat absorption. These conditions include pathologic situations such as biliary cirrhosis, cholecystitis, and sprue. So next. So here, let's proceed to vitamin A, which is one of the um, fat-soluble vitamins. So vitamin A is also called retinol. So this is the chemical structures of vitamin A. Retinol is readily absorbed 80 to 90% from the normal intestinal tract and is stored in body tissues, especially sa liver. So this fish liver oil is actually the richest known natural sources and primary commercial sources. And then most of the vitamin A is found in the animal organs. For example, heart, kidney, liver, and also eggs, dairy products, and fish. This is also derived from some plants, carotenoids, which is from carrots, and also from green leafy vegetables. Vitamin A can help can help the vision, growth, and tissue differentiation. So retinol is ang estimated one-third of the ingested vitamin A is stored under normal circumstances. So again, the fish liver oils, siya ang pinaka-richest known natural sources of vitamin and formerly were its primary commercial sources. So common dietary sources of vitamin A makikita sa animal organs and also leafy vegetables and also only carotenoids that possess at least one unhydroxylated B-ion ring. Vitamin A is involved in vision, growth, and tissue differentiation. A deficiency of this vitamin can actually result in a variety of conditions, including this one, nyctalopia, which is the night blindness, also xerophthalmia. This is an abnormal dryness of the conjunctiva and cornea of the eye with inflammation and ridge formation. So as you can see in the picture, on the left portion, this is what we call xerophthalmia. And also vitamin A deficiency can cause hyperkeratosis of the skin. This is the abnormal thickening of the outer layers skin. So this one on the picture, also growth retardation and also decreased resistance to infection. So vitamin A is indicated specifically for the treatment of a deficiency of this vitamin. A situation rarely encountered in practice. The vitamin is used primarily for prophylactic purposes when normal dietary intake is inadequate or when normal absorption is compromised. This vitamin has not been implicated in any genetic errors of metabolism, but high doses of some analogs. Um, Next. So, acute toxicity. So, this is usually manifest as increased intracranial pressure within 8 to 12 hours, and it has been observed with high doses of vitamin A and a hypervitaminosis. This is a syndrome has occurred with chronic overuse of the vitamin. Symptoms of this syndrome include fatigue, night sweats, abdominal discomfort, anorexia, and vomiting. Competent medical supervision and caution should be exercised with extended usage of daily adult dosage of 25,000 units or more. Or this is equivalent to 7,500 mcg. So the usual US RDA of vitamin A, or the recommended dosage amount for the adults and children more than 4 years old, it should be 5,000 units. For infants, 1,500 units. For children below 4 year old, 2,500 units. And for pregnant and lactating women, that's around 8,000 units. So 1 unit is actually equivalent to zero point 0.3 microgram or mcg of retinol. So that's according to the US recommended dosage amount. For the treatment of a deficiency, the usual dose sa adult is 10,000 to 25,000 units per day, 1 to 2 weeks or until improvement occurs. So vitamin A, this can be taken orally or maybe administered intramuscularly or IM. This is a yellow or a red oily liquid that may solidify when refrigerated, and that should be protected from air and light. So it should be protected from air and light. It may be nearly odorless or may have a slightly fishy odor. It has no rancid odor or taste. It may be diluted with edible oils, or it may be incorporated in solid, edible carriers or excipients, and product formulations may contain um, suitable antimicrobial agents, dispersants, and antioxidants. Capsule, tablet, oral solution, and injection dosage forms are actually available for vitamin A. So next, propriety and description product. So we have here the Aquasil A. So this is used to treat vitamin A deficiency. Aquasil A usually has few to no side effects when used in recommended doses. We have also Alphalene. This is used to prevent or treat low levels of the vitamin in people who do not get enough of it from their diets. So take note, lack of alphaline may lead to night blindness. So tretinoin, this is all trans-retinoic acid, and this is available in several formulations like cream, gel, and solution for topical purposes. It also appears to increase epidermal cell mitosis and epidermal cell turnover and is used to treat acne vulgaris. So this is already familiar to us, the tretinoin, kay kasagaran na siyang gina-recommend sa mga doctor, especially for dermatologists, especially for patient who has cases with their skin problems, especially mga acne or pimple. Prescription products, we have also retin A. This is the tretinoin ingredient used to treat acne. So, form of vitamin A that helps the skin renew itself. So, isa ni siya sa mga topical cream, uh, topical drugs, which is in the form of cream nga gina-apply sa mga tao nga naay acne. Og dili na siya basta-basta pod na ginahatag sa pharmacy store or in any drugstore, kay need ni siya og prescription. Isotretinoin. This is the 13 cis retinoic acid. This is also available for oral use in special situations, and it is approved for use in severe recalcitrant cystic acne. It is also used sometimes in keratinization disorders of the skin. The recommended dosage for cystic acne is 1 to 2 milligram per kilogram of the body weight per day in two divided doses for 15 to 20 weeks. prescription products other than the retin A. We have also Accutane. This is the isotretinoin ingredient. This is a powerful drug used in the treatment of acne. 4 to 5 months of Accutane treatment usually leads to clearing of acne. It is a potent medication that is very effective for nearly all types of breakouts. So Accutane, um, this is actually needed for moderate to severe acne that has failed other treatments. It should be used for a severe scarring acne and is also used for acne present for many years that does not respond completely to all antibiotic pills and creams. So according to the dermatologist, dili sila naga-prescribe aning Accutane if wala pa nila na-try ang mga antibiotic pills. So, okay, magamit lang ni siyang Accutane if na-complete na nila if nagamit na nila ang antibiotics, mga pills, and other creams ang gina-apply sa nawong pero wala gyapon. So, Accutane is needed na if walay improvement sa ilang mga ginagamit before. So, beta-carotene, this is an effective in reducing photosensitivity in individuals with erythropoietic protoporphyria. It does not act as a sunscreen sa mga normal individuals and it should not be used for that purpose. However, 3-carotene does provide a novel and safe approach to the treatment of a specific type of photosensitivity. So the usual dose for this one is 30 to 300 mg or milligram per day, and the brand name for the beta carotene we have here the Solatine. So that's all for my report for the fat soluble vitamins, which is the vitamin A. For the next reporter, we have Anjanette. Anja.
Hello, nanonood ko.
Yes po.
Mm. Yan, naka-assign sa akin is vitamin B, E, and K. Next slide, eh. So vitamin D is a term that is used for several related steroids and their metabolites that are essential for the absorption and utilization of calcium. So vitamin D, kani si vitamin D is called the sunshine vitamin since ultraviolet light is involved in the conversion of provitamin substances to vitamins B2 and B3. 7 di dichidocholesterol is converted to cholecalciferol in the skin upon exposure to the ultraviolet rays in sunlight, and ergosterol is converted to ergocalciferol in vitro by controlled exposure to ultraviolet irradiation. So, naay dati nga na kaning vitamin D daw is di ba gikan sa sunlight. Ang ano niya dili siya ingon nga magpaano ta magpaaraw kay para makakuha ta tag vitamin D, which is ang purpose lang sa sunlight or sa ultraviolet light is ma-convert lang siya into cholecalciferol o ergocalciferol if maigo atong skin o sunlight. So pag ma-expose atong skin sa ultraviolet rays, makabuo ta og vitamin D2 and vitamin D3. Next po. So ang purpose sa vitamin D is it aids in the utilization of calcium and phosphate and is essential to the development and maintenance of strong teeth and bones. So kaning deficiency sa vitamin D is ginatawag siya og weak ang bones sa tiil is kanang naka-curve siya. So kaning vitamin D is readily absorbed from the small intestine of normal individuals, but deficiencies caused by malabsorption are known. Cholecalciferol is absorbed to somewhat greater efficiency than ergocalciferol. So si cholecalciferol is mas greater siya nga ma-absorb sa small intestine compared kay ergocalciferol. Bile salts are required for absorption of the latter material, but these requirements for vitamin D are normally satisfied by dietary sources and by the activating action of sunlight on the skin. So makakuha tag vitamin D usually sa mga ginakaon nato and kanang magpaaraw ta kanang sayo sa buntag. Then vitamin D is also used to treat familial hypophosphatemia. Kana siya is kanang mura siya gyapon og ani osteomalacia nga gikan siya sa family kanang gikan sa parents na inherit sa mga anak. So mao gitawag siya familial hypophosphatemia and hypoparathyroidism, and to supplement the diet in therapeutic regimens involving long-term use of cholestyramine or anticonvulsant drugs. Kaning nephrocalcinosis is a disorder when too much calcium is deposited in kidneys. So si vitamin D is naman siya kanang for strong teeth and bones. Tapos kaning ang calcium is ma-deposit siya sa kidney, masubraan magka nephrocalcinosis. Some infants may show hyperactivity even with low doses. However, most toxicities are associated with prolonged ingestion of high doses and can be serious. Chronic vitamin D-induced hypercalcemia may result in soft tissue calcification, including lethal vascular calcification and nephrocalcinosis. Mo po ning ingon nga naay mga scientists gaingon nga if mag-inom ta og gatas which is rich in calcium pud siya, dapat dili pud sobraan kay maano pud atong bones kanang imbis nga is manghina noon siya. Tapos kaning lethal vascular calcification, mo na siyang kanang naay magbara sa ano, ma-deposit siya sa artery. Mo nang lethal vascular calcification. Next. So, sa vitamins, na si vitamin D2 and D3. So, kanin si vitamin D3, mo ni si cholecalciferol. Primary form of vitamin encountered in zoologic species. It is stored in a number of tissues, including the liver and skin. Fish liver oils are a rich natural source of this material. So, si cholecalciferol, it is rich in fish liver oils. Si cholecalciferol brand Philippines nga nakita nako is si 40D. It is that is linked to bone diseases like osteoporosis. Is another fish. Next. Next page. Next is a
Morning, no? Okay na, Angge? Sorry kaayo. Sorry kaayo hinay jud kay ang net nila ang no. So we will just proceed sa report ni Nicole Gaslang. Ipadaya na lang nato kay Angge later. Nicole, are you ready?
Okay.
Sige. Continue na lang ta diri later na lang si Angge kay maglisod siya. Sige, go.
So, good day. I'm going to report about the water-soluble vitamins. So, next slide, please. So, water-soluble vitamins is a vitamins that is water-soluble. Vitamins are nutrients that the body requires in trace amounts to remain healthy and functions properly. Next, please. So the water-soluble vitamins include vitamin C and vitamin B complex. So in a vitamin B complex, we have thiamine B1, riboflavin B2, niacin B3, pantothenic acid B3, pyridoxine B6, folic acid B9, cyanocobalamin B12. Next. Next slide, please. So, vitamin B1. Thiamine or thiamine is a vitamin B that is water soluble and is found in whole grains, legumes, yeast, beef, and pork. A thiamine was found as the first B vitamin and was given designations designation vitamin B1. So the vitamin is stable in an acidic environment but decomposes readily above pH of 5.0. The vitamin is stable in acidic environment and decomposes readily above pH of 5.0. So berry is the typical case of dietary deficiencies. However, the majority of regularly observed deficiency diseases are caused by the malabsorptions of alcoholics. So, it is the symptoms for berry or weak is include emotional hypersensitivity, loss of appetite, weariness, and physical weakness, and painful peripheral and neuropathy. Next, please. So, thiamine is associated with several infrequently encountered genetic-based deficiencies or inborn errors of metabolism, including lactic acidosis due to pyruvate carboxylase deficiencies, branched-chain amino acid acidofatty, and Wernicke-Korsakoff syndrome. So when we say Wernicke-Korsakoff syndrome, it is particularly with malnourished patients with chronic alcoholism or cancer chemotherapy. So when we say Wernicke, it is characterized by mental deteriorations, nystagmus, ophthalmoplegia, and ataxia. So when we say nystagmus, it is an involuntary arithmetic side-to-side, up and down, or circular motions of the eyes that occurs in the variety of conditions. It's kanang ano gani like kanang makita ka nga tao nga involuntary na kang taas baba nila ilang mo gina-roll nila ilang eyes na inana siya examples. And when we say ophthalmophilia, it is also called extraocular palsy or paralysis of the extraocular muscles control the movement of the eye. So the vitamin is not stored in significant amounts in the body. It is metabolized hepatically and excreted via the kidneys. So next please. And also symptomatic thiamine deficiencies has been reported in women with hyperemesis and hyperemesis gravidium, patients after gastric bypass surgery, and malnourished patients with intestinal obstructions or malabsorption syndromes. So thiamine is required for carbohydrate metabolisms, approximately 0.2 to 0.3 milligram per 1,000 calories, and for some neurologic functions. So because thiamine is a major in the metabolism of glucose, it has long been known the ingestions of simple carbohydrates processed in the body mainly to glucose, automatically increase the need for dietary thiamine. Next, please. So the US RDA of thiamine, or the United States recommended daily allowances for the thiamine, or the daily amount of protein, vitamin, or mineral that the FDA has established. As for the adult and children over 4 years old, it should be 1.5 milligrams. And for the children under 4 years old, it should be 0.7 milligrams. And for the children for infants, it should be 0.5 milligrams. And for the pregnant and lactating women, it should be 1.7 milligrams. The actual requirements may vary some with body weight, caloric intake, and carbohydrates contents of the diet. Next, please. So the maximum daily absorptions of thiamine upon oral ingestions is usually 5 to 50 milligrams. So megadose oral regimens of these vitamins are rarely justified. So thiamine is used to supplement an inadequate diet and to treat deficiencies conditions resulting from intestinal malabsorptions of various etiologies and from certain genetic errors. So thiamine is used to supplement. ah, so thiamine is used to supplement inadequate dietary. So gina-supplement ang thiamine because it enables the body to use carbohydrates as energy. Next, please. So is thiamine is used as the hydrochloride and monotrate salts. It is available in tablet 5 to 500 milligram elixirs, usually 1 milligram per 5 ml, and injections, usually 100 milligrams per ml. So when we say elixirs, it is a sweetened hydroalcoholic liquids for oral use. So adult oral doses are 1 to 2 milligram per day for dietary supplementations, and 5 to 10 milligrams 3 times a day until improvement, of course, in general deficiencies conditions, and 40 milligram per day in alcohol-induced deficiencies, and 10 to 20 milligram per day in genetic enzymes deficiency diseases. Next, please. So parenteral administrations is reserved for critical deficiencies conditions. The adult dose is 5 to 100 milligram 3 times a day by intramuscular or slow intravenous injections. Pediatric doses are proportionally lower. So parental administrations of thiamine can be associated with immediate hypersensitivity reactions, including anaphylaxis, but these are rare. Thus, oral or parenteral high-dose thiamine administrations has been linked to serum enzymes or to instances of clinically apparent liver injury. Next, please. So these are the property and prescription products of thiamine, the betaline S and the biamine. So thiamine uh, it is available on the OTC and included all multivitamins preparations. So the thiamine, wala siya evidence to support it is used as an insect repellent or an appetite stimulant or to treat dermatitis, chronic diarrhea, fatigue, mental disorders, multiple sclerosis, or ulcerative colitis. Next, please. So vitamin B2. Riboflavin or riboflavin is a water-soluble wheat vitamins found in the milk and dairy products, whole grains, legumes, lean meat, and fish. So, so riboflavin is important in fat, carbohydrate, and protein metabolism and is a central component in flavin adenine dinucleotide or FAD or a component of many enzymes that require electron transfers. So these vitamins is essential component of two major coenzymes, the flavin mononucleotide FMN, also known as riboflavin biphosphate, and flavin adenine dinucleotide or FAD. These coenzymes play major roles in the energy productions, cellular functions, growth and development, and metabolisms of fats, drugs, and steroids. So riboflavin can be synthesized chemically, but bacterial synthesis is more convenient and economical for commercial purposes. So these are the chemical structures for riboflavin. So most commercial riboflavin is currently produced or was produced earlier by microbial synthesis using special selected strains or Bacillus subtilis, Ashbaya gossipii or gossipi, and Candida camata. Next, please. So yeast is the richest natural source of riboflavin. So riboflavin occurs in the food in the free form and as riboflavin 5-phosphate or flavin mononucleotide or FMN and flavin adenine dinucleotide. So the dairy products, eggs, legumes, and meats are the main dietary source of this vitamin. So small amounts are provided by cereal grains, fruits, and green vegetables. So riboflavin is stable during cooking in the absence of light. So riboflavin is destroyed by light. So food should be stored away from light to protect its riboflavin content. While riboflavin is not destroyed by heat, it can be lost in water when foods are boiled or soaked. So roasting and steaming food preserves more riboflavin than frying or scalding your foods. Next, please. The primary storage sites for bound riboflavin are the heart, kidneys, and the liver. So free riboflavin is rapidly eliminated by the kidneys. Peak beat concentrations occur within 2 hours following ingestions of large doses of vitamins. So the nucleotides are hydrolyzed to riboflavin, the upper gastrointestinal tract, and the free riboflavin is absorbed readily into cells of the intestinal mucosa by an active transport system that is enhanced by a bile salt. So the riboflavin is phosphorylated by mucosal flavokinase, and the FMN is bound to plasma albumin and transported to the liver. Next, please. Uh, The FMN and FAD functions as coenzymes in the transfer of electrons in the number of important biological oxidation reactions. T-riboflavin-containing enzyme systems include glucose oxidase, Warburg's old yellow enzyme, amino acid oxidase, xanthine oxidase, cytochrome reductase, succinic dehydrogenase, acid coenzyme, uh, dehydrogenase, and erythrocytes glutathione reductase. The last enzyme is useful for biochemical indicator of riboflavin deficiencies. So these enzyme systems cover both aerobic and anaerobic conditions and are usually designated oxidases and dehydrogenases respectively. Next, please. So riboflavin deficiency Riboflavin deficiency is rare but can occur with severe malnutrition and chronic alcoholism, and usually presents with specific symptoms including weakness, sore throat, mucositis, cirrhosis, glossitis, dermatitis, and anemia. And a few specific regimens for these riboflavin deficiencies, uh, phenol, phenothiazines, tricyclic antidepressants, and probenecid. Although riboflavin seldom causes toxicity in those with normal renal functions, yellow discolorations of the urine may cause concern in patients uh, taking high doses of the vitamin. Hemodialysis removes riboflavin but more slowly than normal renal executions. Next, please. The USRDA of riboflavin for adult, it should be adult and children over 4 years old is 1.7 milligrams, children under 0.8 milligrams, infants 0.6 milligrams, pregnant and lactating women 2.0 milligrams. The actual requirements for riboflavin vary somewhat in a caloric intake. So there is no evidence to justify ingestions of megadoses of this vitamin. So riboflavin is available over the counter in the multiple forms and is included in most multivitamins preparations and typically concentrations of 0.3 to 1.7 milligrams. So riboflavin is yellow in color, has natural fluorescence, and is inactivated by light. So oral forms of riboflavin have not been associated with adverse events. And hepatotoxicity, even when given in high doses, One reasons why high doses of riboflavin are well tolerated is that oral doses above 30 milligrams are not absorbed, and what riboflavin is absorbed is rapidly excreted, and body stores are generally limited. So, next please. So in this slide is the usual dose for treatment of treat deficiencies. So 5 to 30 milligrams per day orally in uh, divided doses for several days, followed by I'm sorry, followed by 1 to 4 milligram per day dietary supplement dose. For the usual initial pediatric dose, 3 to 10 milligram orally for several days, and then 0.6 milligram per 1,000 calories ingested for dietary supplementations. Intramuscular administrations reserved for deficiency situations in which oral administrations is not acceptable. The usual adult parental dosage is 50 milligram. So it has not been um, approved effective for treatment of acne, migraine, headaches, or muscle cramps. So riboflavin is available in tablet in 5, 10, 25, 50, and 500 milligrams, and injections for 50 milligram per ml dosage forms. So it is usually formulated as the free riboflavin, but niacinamide or some other suitable solubilizing agent must be added to the injectable product. So a number of propri- proprietary products are market under the generic designations of riboflavin and vitamin B12. Next, please. So the prescriptions and product of riboflavin is Riobin 50. So mo ni siya ang picture akong nakita or na-search sa Google. So nag-search pud ko lain na mga ano. So ingani lang akong kasagaran. I don't know if naabad di siya available ba siya sa diri sa Philippines or na siya lahi ang tawag or lahi ang brand name sa tuwa sa Philippines. Diri sa Philippines. Next please. So that's all for our report. Thank you for listening and have a good day.
So in continuation, mahina kasi yung internet. So vitamin D2 is also called as ergocalciferol, and it is derived from ergosterol, a plant steroid. It is the form of this vitamin normally used to fortify such foods as milk, bread, and cereals. Vitamin D resistant rickets. So, kaning Drisdol is ang dosage niya is 12,000 to 500,000 international units daily. This is for hypoparathyroidism, 50,000 to 200,000 international units daily, concomitantly with calcium lactate 4 grams 6 times per day. Next, ergocalciferol Drisdol. Next is for vitamin A and D. This is a solution of vitamin A and vitamin D in fish liver oil or is an edible vegetable oil. Vitamin A and D is available as a capsule usually containing 10,000 units of vitamin A. Then 400 units of vitamin D. Vitamins A and D are also available in a number of topical emollients for temporary relief of minor burns, sunburn, windburn, abrasions, chapped skin, and other skin irritations. For example, this is Balmex for diaper rash and Caldicin. Powder ni siya. Next. Cod liver oil is inhabited from North Atlantic Ocean. This is cod liver oil is from codfish. This is the product of the fishing industry. So ang process niya is the livers are removed during the fish process and frozen until subjected to a steaming process to remove the oil. The steaming takes place in closed containers in a carbon dioxide atmosphere in order to prevent oxidation. So the separated oil is chilled to a temperature below 5 degrees Celsius. The precipitated stearin is separated from the lighter vitamin-containing oil by decantation and filtration. And finally, the oil is adjusted to a definite vitamin content by admixture, if necessary, of different lots with higher or lower vitamin levels. So, cod liver oil. Galing siya sa codfish, galing siya sa liver ng codfish. Doon galing yung oil. It is primarily distilled fixed oil obtained from the fresh livers of Cadus morwa. Cadus morwa. Cod liver oil. Nang ginainom sa mga mama. Next is vitamin E. So it is a term that refers to various forms of alpha tocopherol, including the rotatory isomer, the racemic mixture, and their acetate and acid sucrate esters. So, ang alpha tocopherol is the most common na vitamin E. So, kung makita ninyo example si Myra E. So, ang uses niya is antioxidant. The vitamin may help preserve the integrity of cellular membranes, including those of red blood cells, by preventing free radical attack and peroxidase cleavage of unsaturated bonds of lipid membrane components. Si vitamin E is pwede siya immune sa babae at lalaki. So, sources of vitamin E is usually nasa sunflower nuts, mga green leafy vegetables, and nasa plant oils. So, it is also used to treat syndrome sometimes encountered in premature infants that may actually represent a deficiency state. So, pwede din ito sa cancer, fibrocystic disease of the breast, sickle cell disease, katong ang RBC niya, di ba, imbis nga murag round siya, sa sickle cell disease is murag half moon ang red blood cells. Nga na ang sickle cell disease. And then, a large number of my claims about sa vitamin E nga, ang vitamin E increase physical endurance and to prevent osteoporosis or aging and to treat loss of hair or menopausal syndrome. Pero claims lang siya, pero hindi pa siya proven ngayon. Meron ding mga lotion about vitamin E. Dili lang siya yung mga ginainom, pwede din siya lotions and creams para sa anti-aging daw kunwari. O whitening sa skin. Next. So dosage, the USRDA for vitamin E is 30 units for adults and children of over 4 years of age, 10 units for children under 4 years. 4 years and above, 30 units, then below 4 years old is 10 units only, and 5 units for infants. The usual adult dose for vitamin E is 30 units per day para siya sa prophylactic purposes. And 60 to 75 units kung para siya sa vitamin E deficiency. Vitamin E is usually administered orally but may be given intramuscularly in cases of severe absorption problems. So, ang capsule nito is 30 to 1,000 units. Tablet is 100, 200, and 400 units. Muna makita nimo sa vitamin E is sa Myra is 400 international units na siya. Ang toxicity niya, very high doses of vitamin higher than 800 units per day. So, mo to ginaingon nga sa Myra E, 400 units per day lang siya. Once a day lang ka mag-inom. But if higher from 800, maka-cause na siya og bleeding sa vitamin K deficient patients. Bleeding siya and muscle weakness, fatigue, and nausea. Next. Next is vitamin K. Term to next is vitamin K. This is a term refers to 2-methyl-1,4-naptoquinone and derivatives of this compound that exhibit an anti-hemorrhagic activity. Vitamin K is necessary for normal clotting of blood. So, ang duha ka vitamin K nga example is vitamin K1, phytonadione. Next is menadione. So, si vitamin K1, it is absorbed from intestinal tract only in the presence of bile salts. The vitamin K3 are absorbed directly. So, ang lymphatic system is the major means of transporting vitamin K to the liver, where it tends to concentrate. So, kaning vitamin K1, this is found in green leafy vegetables. Synthetically prepared phytodione is used for therapeutic purposes. Next. Next. Vitamin K deficiency. So, ang vitamin K deficiency nag-lead siya into hemorrhage. What is hemorrhage? This is a loss of blood from a damaged blood vessel. Kung makita nyo sa picture, yung blood vessel kay nasira siya. So, ang bleeding or vitamin K, this is the most common symptom in vitamin K deficiency. Vitamin K deficiency is hemorrhage is the most common symptom of this, and hemorrhage is a loss of blood. Ang causes nito is alcohol, drug or tobacco use, cancer, yung bruises, yun, tapos complications from medical procedures such as surgery or childbirth, and damage to an internal organ. For example, nabuk ang ulo or natunggaban, mag-hemorrhage, kanang aneurysm kanang sa brain, something na ay matuan dira nga blood vessel, tapos pwede siyang ikamatay. So kung serious ang blood ang
So to continue, sorry, kahinay jud ka anat ni Anjanet. So vitamin K deficiency, one of the vitamin K deficiency is the hemorrhage. So this is one of the most deficiency for the vitamin K. So what is hemorrhage? So this is the loss of blood from the damaged blood vessel. So as you can see sa picture, muna siya ang mga lost blood nga nangawala, or this is the bleeding, can be inside or outside the body, and blood loss can be minor or naay major. So serious blood loss may make you feel cool when someone touches your skin, dizzy, hilo, tired, nauseous, hirap sa paghinga. Then if this left untreated, you may experience chest pain, confusion, faster breathing or heart rate, organ failure, seizures, shock, coma, or death. So again, ang causes nito are yung pag-iinom, drug or tobacco use,
ana
cancer, bruise, complications from
ko
medical procedures such as surgery or childbirth, damage to an internal organ. Yes. Madungog ka. Padayon ka. Magpadayon ka, angge. So to continue, one of the recommended na gamot for the hemorrhage is actually the phytonadione, which is one of the vitamin K prescription. This is used to prevent bleeding in people with blood clotting problems or too little vitamin K in the body. It is also administered by subcutaneous or IM or intramuscular injection. So the dosage for this one, the usual dose for this to treat hypoprothromburinemia attributable to anticoagulant drugs, malabsorption, or other causes is 2 to 25 milligrams sa mga adults. Then for the children, it's 2 to 10 milligrams. And then for infants, it is 1 to 2 milligrams. For the response of prothrombin prothrombin time should be monitored, and the dose may be repeated after 6 to 8 hours if necessary. So this drug, kailangan dyan na siya monitor by the doctors or even the pharmacist or the clinical pharmacist. A 1 milligram dose is frequently given to neonates to prevent hemorrhagic disease since placental transfer of vitamin K is low and intestinal microflora has not yet been acquired. For the tablets, it is 5 milligram, which is available for oral use. The usual dose for this is 2.5 milligrams to 10 milligrams and may be repeated after 12 to 48 hours if necessary. Next. Okay, so that would be all. So these are our reports for the vitamin and the vitamin containing drugs. I hope you somehow understand our reports, even though we have some difficulties, especially the internet issue from my group mates. Thank you so much, and again, good afternoon.